When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
All right, who has that glass of wine after work every day? It's just one glass of wine. Maybe it's one glass of red wine, and you could have sworn you've seen studies that say you can drink one glass of red wine every day. Maybe it's even good for you. Well, it turns out that one glass a day might still be bad for you. It turns out there's actually no threshold when it comes to alcohol consumption that is deemed safe. And on Tuesday, a report was released by the Canadian Centre on Substance Abuse and Addiction, responsible for reviewing guidelines on alcohol consumption. In it, they recommend that Health Canada change its approach to encourage people to drink less and make warning labels on bottles mandatory. With more on this, we go to Dr. Peter Butt from the Canadian Centre for Substance Abuse and Addiction. They're behind this report. Dr. Butt, welcome to the program.
Thank you very much.
So, I guess I'll start off with how I led off this introduction here. I bet you there are a ton of people that drink one glass of wine a day, and maybe they even do it for health reasons. What do you say to those people?
Well, what the evidence shows is that they would be best advised to decrease the amount that they're drinking. Less is better, given the impact of alcohol on health. If they were to go from that 7 standard drinks per week down to even 6 standard drinks per week, they would be going from a higher risk zone to what we call a moderate risk zone. 3 to 6 standard drinks per week would be considered moderate risk, and just 1 to 2 standard drinks per week would be considered low risk. So people really do need to reflect on how much they're drinking and consider their own risk tolerance and their risk of other alcohol-related conditions such as cardiovascular disease, cancer, infectious diseases, mental health issues, and so on.
So, doctor, and I know you probably can qualify all of the studies that on illnesses and disease that come out of drinking alcohol. I want to maybe point this at you in another direction, right?
Sure.
The people that'll say to me, Elias, that glass of wine at 8:00 in the evening, after dinner or before dinner, that one glass of wine gives me so much joy. I never overdo it. I don't get drunk at all, but I want my glass of wine or I want my one beer when I get home from work. People get joy from that. So how do you as a doctor, right, do the balance between what you can quantify, this percentage of people are going to get a disease because of alcohol, versus the unquantifiable joy and happiness that comes out of those things in life?
Well, absolutely. There's joy, and there's joy in socializing, and there's joy in a number of other activities. So it really is a case of individuals deciding for themselves what's the best balance for them in their life. We're not telling people how to drink. We're saying, here's the evidence with regards to alcohol and health. Here's our best guidance. But then we have to respect that people are going to make their own decisions given their own situation. And this isn't about killing all joy in life. This is not a prohibitionist approach. We've simply presented risk zones in the evidence and said, this is more of a challenge than we thought it was in our life. Alcohol is a carcinogen. Strange that it's not labeled as such. But with regards to that one drink, fine. If they're able to hold it to one drink, sometimes then people increase when it's a special occasion. They say, well, it's one drink every night on a special occasion. Maybe it's 3 or 4. And the amount per week increases. And increasingly they get into a riskier level of consumption.
I think another reason why this report is getting so much attention is because of the drastic drop, right? So, we were at basically 2 drinks a day, 10 a week for women, 3 drinks a day, 15 a week for men, right? That's a huge drop. In your estimation, was that drastic drop in the number necessary?
Well, I don't know whether or not it was necessary. It is what the evidence shows now, and the evidence, and so it was necessary in terms of informing the Canadian public. Mm-hmm. So again, we're not mandating this. We're saying, folks, here's what the numbers show. It was sobering for us as well, quite frankly. We knew it was going to decrease, but we didn't think that it would come out as low as it did. And that's why we landed on the risk zone approach, so that just telling the public, you shouldn't drink more than 1 to 2 standard drinks a week, that wasn't going to fly with people. That was much too dramatic a shift. So we used the risk zone approach so that people could be better educated, improve their alcohol literacy, and reflect on how much they're consuming and how that aligns with their own health and wellness goals.
We're with Dr. Peter Butt from the University of Saskatchewan. We're talking about alcohol consumption and risks of alcohol consumption. So let's talk about those zones, right? The low risk, 1 or 2 standard drinks per week. Moderate risk, 3 to 6 standard drinks per week. Increasingly high risk, that's 7 standard drinks or more, right? So these are the new the zones you mentioned. Those are the zones?
Yes, and also there's another recommendation in there in terms of per occasion drinking. If people drink more than 2 standard drinks on an occasion, they're more likely to run into problems with violence, accidents, and injuries. So that's an important metric as well.
So let's give the cold hard truth here on what you're putting yourself at risk with increased alcohol consumption, right? Because maybe some people aren't aware here.
Absolutely.
What are the cancers?
The risk zones are sometimes hard to communicate. Mm-hmm. So typically for unintentional exposure to things in the environment, like in the air or the water, the international standard for risk is 1 chance in a million of coming to harm. With regards to intentional activities like unprotected sex and that sort of thing, the risk tolerance level is defined as 1 in 1,000 in terms of the potential for coming to harm. So 1 in 1,000 was helped for us to define the difference between low risk and moderate risk. Uh-huh. 3 to 6 is moderate risk, and we use the 1 in 100 risk, 10 times greater than the internationally accepted standard for unintentional exposure. We use the 1 in 100 cut point because that's what internationally has been used to define low risk for alcohol consumption for social, economic, and cultural reasons. So it takes into consideration those issues that you raised in terms of people's attachment to alcohol, how it's used as a social lubricant, how it might bring joy in people's life, and so on. So that's where the moderate zone shifts up. But even at that moderate zone level, the cumulative effect of alcohol increases the risk for cancer. And as you get into the increasingly high-risk zone, you're now adding in increasing risk with regards to cardiovascular disease, infectious diseases, mental health problems, and pancreatitis, and so on.
With that in mind, Dr. Butt, is it time now for labels, warning labels on alcohol?
Well, certainly we've recommended back to Health Canada that consideration be given to communicating this to the Canadian public. And one of the best ways to do that would be to have labeling at the point of pour, so people know how many standard drinks are in that bottle or in that can, whatever the case may be. And it's so much easier for them to manage if they can measure. Having just % alcohol by volume makes it a little more challenging to be able to say, okay, how many standard drinks have I actually had? Mm-hmm. And the math gets difficult as you drink more. So having the number of standard drinks on the container would be most helpful. And then, of course, there's the whole issue with regards to warning labels. Is it reasonable, and in fact, it's illegal for an industry to promote a product that they know will bring people to harm without providing labeling, without providing a warning? But the alcohol industry hasn't done that historically, so perhaps it is time for people to be told at the point of pour, alcohol is a carcinogen. We know that. We've known it for decades. It's also teratogenic. It causes birth defects. This is just about respecting the consumer's right to know. It's not about fear-mongering. It's just, folks, you have a right to know, and you need to be informed in terms of making the decisions with regards to how much you're going to use.
Well, Doctor, with all the things that do have warning labels, it is pretty surprising that alcohol isn't one of them. We have to leave it there. Great discussion, and I thank you for coming on.
Thank you so very much. Have a good day.
That is you too. That is Dr. Peter Butt, and he's co-chair of the Canadian Centre for Substance Use and Addiction.